captive audience. If there's any questions that need to be asked of MMC, now would be the time. Commissioners?
Mr. Chairman,
Yes.
I appreciate Ms. Amijo and Mr. Harris and the rest of the team here from MSC to join us. It's been a little while. I think, I can't remember if it was 2019 or 2020. That was the last time I think we saw MMC here in the chambers, and it was around the fact that MMC was interested in looking at the lease agreement and trying to change several clauses in there. And in particular, it came around the capital investment amount. Now, yesterday, I know you all had the pleasure of presenting to the city council. And so I did want to ask, because I didn't think there was a clear determination or answer when Mayor Pro Tem Bencomo had asked what is your, we talked about the community benefits, and I see the flyer that was provided here. But what was your annual revenues for 2023?
Okay, so LT, would you like to address that question? Because they're asking regarding the annual revenues. We don't have that. Okay, so yeah, we would have to actually gather that information and provide it back to you because we don't have that readily available to you, but we're happy to.
And I'd be curious because I think as you note the $8 million in capital improvements, and I know it was splitting hairs. I know when you go in, it's just under $8 million. But I'm just curious to know if that's within the contractual obligations of that. And that's not very clear in this presentation because I know, like I said, I know it's been, as comments that were made, I think, by Mr. Harris yesterday. I think there was comments about the fact that recruiting and retaining doctors was could be considered capital improvement, but I think it's very clear that the requirement in the lease agreement is actually to make investments on the life of the building. And so I'd love to understand, like I said, are you all in compliance with that?
So Commissioner Sanchez, what we can do is actually get back to you with the information that was requested today, as well as what was requested yesterday from the city. So that way we can do a detailed report on, what improvements have been made from capital expenditures, because we have, we have invested in equipment, facility improvements, and so we can provide that information. So that way it's very clear to everyone.
Okay. Thank you, Ms. Armijo. The other thing, and I'll just note, and like I said, I'm glad we're having this conversation. And I think even as Commissioner Chaparro had said, I think we would love to be able to make this a more regular opportunity for us to be able to have more discussion with MMC. Because I think while I know there is in the past having a seat on the board with the county manager and city manager, I honestly have not had any updates from or received any updates on MMC's numbers, performance, any of that. And now I don't know if that's ever provided in detail, and maybe that's within our staff that isn't providing us as the Board of County Commissioners with that information. But it's something I've never seen. I know it's as a requirement of the lease agreement that we're supposed to have, and I've never seen it. So I'd love to be able to dig into that a little bit more and figure out where the breakdown in communication is. The other part that I have concerns with is also around how it was noted around the specialty services, and even yesterday it was brought up about the services, but I don't, and maybe that's with the updates. I haven't seen that investment or increase in specialty services because I'm a person myself, not of me, but of a family member that we have to travel to El Paso. And I've heard this story multiple times where we're continuing to have to travel to Albuquerque, El Paso, Tucson, Phoenix. And so I still see that we're a underserved community. So,
Yep.
you know, I'd like to understand what it is.
Sure.
Memorial Medical
So
Center is working on that.
each month during our board meetings, we do provide financial updates as well as quality information. And then any updates regarding like physician recruitment services that we're starting. So that information is shared monthly with the board, and the presentation and the information is sent out. In regards to being an underserved community, absolutely, you're correct with that. An example that I gave yesterday at the city was our urology, for example. So there is an independent urology group, Rio Grande Urology, who does practice at Memorial. And there were 4 urologists in that group. One urologist actually left Las Cruces to move to El Paso due to the medical, malpractice capitation rates in New Mexico. So New Mexico has the oldest medical staff in the United States, and we have the highest capitation rates, which means that it makes it very difficult for us to be able to recruit doctors into Las Cruces. And so that's just one specialty, but also ENT is another area. We do have a full range of general surgeons. We have orthopedic surgeons here. Obviously we worked on cardiology because that was a dire need here in this community. But because of medical malpractice, that is very difficult. The other issue or item that we have to look at is that we do recruit in J1s. So because Las Cruces is a underserved community, we have the ability to sponsor doctors from, they're from out of country. And so we do have a team of people that we work with that helps us with recruitment. So New Mexico allows for 30 J1 candidates each year, but that's spread throughout the state of New Mexico. And so when Senator Henrik was here and we met with him, that's one thing that we asked for him to take back, is that could you expand that number to a larger number, because we are so underserved. They're just very hard to recruit specialties. We agree with you. We don't want people to have to travel. It's very expensive for people to do that, and we want to provide the care here. But again, it's difficult sometimes to recruit those specialties.
Okay, thank you, Ms. Amigil. I have one more question, and I'm just curious because I know after this we're going to be considering the approval of a contract with MMC around the coverage of cancer patients, I think is one. But one of the concerns I have is that this has been something that, as far as I recall, from what at least I know, the county has been trying to work with MMC on cancer requirements or cancer treatment. And so I was just wondering, there was such a delay in getting this through. It was my understanding that MMC was reviewing it, going through it. And I'll just be honest, the optics of it look like all of a sudden you're on MSNBC and then boom, next thing, y'all are ready to approve it. And the same thing with you all here. What was the delay in that? Because I think is with us trying to provide funding through the indigent care, and it was something that I think we as a desire as a county commission have had. But I felt, and maybe I'm incorrect because I wasn't involved in the day-to-day as, say, Ms. Jamie Michael was. But I want to know, where was the delay and why was there such a delay that and even maybe even understanding why we had to specifically call out cancer treatment instead of that falling within within the care you provided. Because I know as a resolution and within our side of things, we did approve that. And then we had to go in and then negotiate an agreement with you all. So I'm just wondering where that is, because we're trying to figure out how, as maybe a lessons learned, how do we get better at this? And how do we start bringing things forward? Because I think as Doña Ana County, we want to make sure that we're serving the residents in our community.
So Commissioner Sanchez, I'm going to turn this over to LT because she is very intimately connected with the contract in the negotiations.
So, hi. We actually received a request from Jamie Michael and have been working closely with her for this. The timeline doesn't correlate with the news coverage at all. We've been working on it since, I think, August, September of last year. One of the biggest holdups was trying to figure out how do we create a contract that is a payer contract that is not necessarily built into the way that the county does their contracting. And so it took a lot of resources to try and figure out how do we, and we ultimately went to an outside legal counsel to try and figure out how to actually draft that contract. Once we sent that contract over, then we were able to redline back and forth. I think it went back and forth maybe 4 times. And that's why we're ready to submit it today. So the timeline doesn't really correlate with the news. I know it probably looks like that, but we've really been working on this for quite some time. And the biggest holdup was just the legal verbiage in the contract itself and how to word that so that it was optimized for both parties.
But why was I guess I'm kind of curious, why is cancer and cancer treatment specifically singled out that we had to call that out on a separate contract versus what was the existing contract, provide services to the indigent community?
So my understanding is that in 2016, I wasn't here, there was a decision made to remove the cancer indigent care out of the lease agreement. And so that was removed out. So what we were looking for is compensation based on Medicaid rates. So it's not like, we're asking for discounted payers or commercial payer rates. We're looking at fair and equitable compensation for the services that are provided for indigent care. I will say that we are not expecting a lot of assistance from the county for cancer patients, just because there are so many resources and the county is a payer of last resort. So one of the biggest things that we do see is people coming in that need premium pay assistance. That's not something the county can offer legally. It's not something we can offer legally due to enticement laws. And so that is something that our not-for-profits in the community can provide us assistance with. And also that deductible, things like that. That's why we work with our patients. When you get the cancer diagnosis, you're going to be shocked. It's something that dramatically affects everyone, family members, the patient themselves. We give quite a bit of time and leadway in contacting those patients to ensure that they understand what their resources are and their coverage are, and we do not expect for them to pay upfront when they come in for their cancer treatment. But we do need some type of coverage. The cost of the drugs alone, the pharmaceuticals alone, are thousands and thousands of dollars per treatment. So Medicaid is only assisting in covering that.
Okay, thank you. And I agree. I think, we want people to be able to receive the treatment because it is mentally, when you're having to deal with that, it's a huge shock.
Yes.
But I think when we hear of stories, when we hear of constituents that are having to go elsewhere because they weren't able to receive care here, I think that's always disturbing to hear that. But I'll turn it over back to Mr. Chairman.
Thank you. Thank you for that. I just have a couple questions, and it does go hand in hand with the questions that were asked by the city council yesterday. I kind of expected that we would have had some answers to their questions, as they probably would have been along the same lines as far as that. So I'm kind of disheartened to know that we didn't have answers, but I did do a lot of research last night, and I just have a couple questions. So according to some tax documents that I found online, in 2022, your guys' revenue was $1.8 billion, with a B, not an M. So out of that, from what I can find out, in 2019, your guys' net profit was $180 million. And that's what I found online as far as years go, which means that 8% of profit versus revenue is nowhere near the capital expenses that you guys are putting into into your facility. But along that, I do have a question. So based off of the $1.8 billion that you guys took in 2022, how much of that, besides pay and all that kind of stuff, stayed back into Las Cruces, and how much went back to your parent company?
So none of our funds go back to our parent company. We're actually a completely separate legal entity. Of the 1.8 billion that you're referring to, those are actually charges. So when I had spoken earlier, I talked about, the contracting with the insurance companies. We're about 80% government payer, a little over 80% government payer. The government sets those rates, so no matter what our charges are, they're irrelevant to the amount of dollars that would be reimbursed by the government or by the insurance companies.
But that's revenue, so that's what you received.
Yes, that's what we call net patient revenue.
Okay, yeah.
Would
So
be the
that's what you
smaller
received
amount.
is 1.8 billion.
No, that's the amount we charge.
No, that's what your revenues were in 2022.
That's our gross charges. So our actual revenue is 180 million, I think that you referred to.
That's net profit. I'm talking about the revenue that you received it said net income or gross patient revenue is 1.8 billion in 2022.
I know it can be very confusing, but we do not receive $1.8 billion in net patient revenue.
Okay, so what is that number then? If you know it's not 1.8.
It's the 180.
No, that's your net profit is 180 million.
It's not, I promise.
So your hospital is only making $180 million a year in revenue to pay.
Yes.
Can you go back to your slide then that shows what you guys?
130.
Yeah,
130?
and what I can do is that we actually provide this information to the person for the county that sits on our board every month. And we can definitely provide the information that, for that.
Okay. So based off of just a quick calculation then, you guys are spending $212 million and you're not receiving revenue of more than 180 million?
Let me put the numbers together for you.
Okay. Yeah, if we
Because
can get
we
that.
present this every single month in the board, and I think it would be good to show it in that format.
Okay. Jamie, by any chance, do you have those documents from your last meeting that you can present? Okay. Okay, because from your tax returns, it says 1.8 billion. So that's what I'm going off of. But we definitely need a correct answer on that. So maybe that work session would be really great. But based off of that, how much of that is staying in our community of Doniana and Las Cruces?
It's the community benefit overview, so that's the total. So what I'd really like to do is be able to put it in a line item,
Yes.
which Jamie can actually provide to y'all. And we do that in the community benefit report. I'm just not, there's a lot of numbers that I work with on a daily basis. So it would be really great to be able to provide y'all with a format that is what, I mean, we can be very transparent with you in the
Yes.
numbers that we share. I just don't have that information available currently.
Okay, and then just out of curiosity, this 1.7 million in community benefits program, what is that exactly? What does that entail? As
So
far as
it breaks down into several different categories, taxes being one of the larger.
well, your taxes is 18. I'm asking what that 1.7 million is.
I'd have to go and look at the details behind that.
Okay. And then during the presentation, you all said that you did $900 million in community, giving back to the community. Over what time period is that? How many years?
That was since the Life Point taking over the hospital.
Which was in what year?
It's before I was here.
We don't know when Life Point took over Memorial
2000.
Hospital?
Okay, 900 million in the last 5 years.
Okay, so in 5 years, you guys put 900 million back into the county, we'll say, into Cruces. Okay. Yeah, we're definitely going to need these answers during a work session. So, Mr. Lopez, I am asking that we do what Commissioner Shabhado said and get a work session on the books, preferably one in the later part of the afternoon. I hope that you and your executive staff can come back and talk to us. Actually, we had a great joint work session with the city of Las Cruces, and maybe that's exactly what we should do again since this affects both of us.
I received the message on a work session. I'm seeing head nods and head shakes on a joint with the city.
Take a poll later on and see if there's any interest, I guess. Because
Very good.
I'm sure a lot of these questions are mutually shared. Any other questions from the board? I'm sure there is too, because
And were there any other questions that we need to address in the work session? Because I want to make sure that we cover everything that you guys may have questions with, that we can come back with.
Mr. Chair, if I may,
yes.
it's really difficult to give you a guideline on the questions that will be asked from the community, quite frankly. I think that the board will have questions regarding the fiscal or the numbers that you're presenting and how they're utilized. But in order to move forward, at least in my opinion, is to have that kind of community input and what our community has a vision for with Memorial Medical Center.